Good morning and thanks for watching All Things Heart. I'm Alexis Del Cid. Right now, we're working hard to bring you all new episodes of Season 7. Until then, we'll be airing Encore presentations. So sit back and relax and enjoy this Encore presentation of All Things Heart. A drawer full of medications and a lifetime of overwhelming diagnoses. We share Haley Taylor's journey to better health and a bright future after she refused to take no for an answer. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Hope. Haley Taylor found it right here at the University of Kansas Health System. She went from hearing other doctors at other places tell her that she didn't have a future to becoming a nurse, a wife, and soon to be a mom.
This is a mobile I made, our crib, our bassinet.
Standing in the nursery of her baby girl due December 8th.
These are some Taylor Swift lyrics because I'm a big Taylor Swift fan.
With the handmade decorations and carefully picked out color scheme.
I made some wall daisy decor stuff. We'll hang up. I like the pinks and stuff.
33-year-old Haley Taylor's journey to this point is a long time coming.
I didn't ever know this day would come.
Haley has survived more unique health problems and scares than anyone should ever face in their entire life.
Have you heard the saying of like, when you hear hooves in a hospital, think horse, not zebra?
When you hear hooves in a hospital, think horse, not zebra. It's something a cardiologist told her years ago, meaning the diagnosis is usually the obvious one. But in Haley's case,
cardiologist once said to me, "You're not a zebra, you're a unicorn."
Nothing was obvious or easy, as you can see by her medication drawer. The trouble began right after Haley was born with 2 holes in her heart. As a baby, she underwent her first of 4 open heart surgeries before the age of 17, along with too many procedures to even count. She was later diagnosed with a leaky heart valve, subaortic stenosis, which is a narrowing below her aortic valve, and pulmonary hypertension, known as PH. PH causes high blood pressure in the arteries that supply the lungs. It causes Haley to tire easily, have chest pain and lightheadedness, and sometimes she struggles to get a good breath.
It's like breathing through a straw, basically.
If you look carefully, you may also see darkening or swelling along her lower legs.
It's harder for my heart to get all the blood back where it needs to, so blood like pools.
And if that's not enough, she's also had 2 brain bleeds caused by the blood thinners, along with a craniotomy.
It'd take part of my skull off and drain all the blood out.
Despite all the obstacles, Haley kept pushing forward her whole life, graduating high school, then college, and getting her nursing degree.
I had a lot of great nurses when I was in the hospital, And I think that's what just really drove me to want to help people and do the same thing that they did for me.
In 2020, she married the man of her dreams. And when they tried to adopt a baby, they were refused by every agency because of Haley's health history. But Haley and her husband were determined.
We are having a baby through surrogacy.
And when her baby girl is old enough to watch this story, Haley has a message for her daughter.
Just that she's very wanted and loved.
Are you happy?
Very happy.
We are so pleased to have Haley with us in studio today. Thank you for being here.
Thanks for having me.
You getting misty?
Yes.
I was too. I love seeing your baby room. We also have pulmonologist Dr. Tim Williamson, cardiologist Dr. J.D. Surface, and pediatric critical care specialist Dr. Sean Sood. I think everybody's tearing up looking at that journey. Oh, and we have her husband, Harrison, who's in the control room. Can we show a shot of Harrison? There he is. Oh, he's being shy. He's so handsome, and he came to support you this morning. Haley, you're so determined and you're so strong. I can't imagine what that was like being told at 17 by a different doctor, no names, don't say the place, but how did you handle it when you were told that there was nothing they could do for you?
I just remember sitting in the hospital room with my mom, crying, and my mom was just like, that's not gonna work for us. And she started researching other places, and that's when we first went to Mayo Clinic, and the Mayo Clinic said, you need somewhere local, you need to go to KU.
You need to go to the health system.
Yeah. So we did that.
Oh, how horrible for you and your mom. Dr. Williamson, first of all, thank you for being here. It's really interesting to talk about this topic because of the heart connection and everything involved. But can you explain to our viewers, what is pulmonary hypertension? What's happening in the body?
Yeah. First of all, we hate hearing those stories where folks are told that, and that there are so many things we can do, so glad we're getting that message out to folks.
Yeah.
So pulmonary hypertension is basically high blood pressures in the blood vessels that go from the heart to the lungs. Lots of different things can cause that, but the part of the heart that squeezes blood to the lungs, it doesn't like pumping against high pressures, so it can get bigger, it can get sicker over time, and you can have some of those things like the blood pooling and those sorts of things. In pediatric patients, the majority of that is caused either by one of two things. It's not the only things that cause it, but either congenital lung disease or prematurity lung disease or other things with the lungs, or in this case, congenital heart disease that Dr. Surface can talk much more about, where there's actually abnormalities in the lungs or the blood vessels, so there's abnormal plumbing, so to speak. So anything that causes those high pressures, though, can have that negative impact on the part of the heart that's trying to squeeze against them.
When it comes to the pediatric cases, Dr. Sood, we're going to get to you in a minute. Dr. Surface, you have a patient that you have to get to. You're on a deadline, so we're going to ask all your questions right out of the gate. As a cardiologist, you work alongside Dr. Williamson treating pulmonary hypertension patients. And you're going to see your first appointment with Haley is in January, so nice for you guys to be introduced on our program here. Were the holes in Haley's heart related to her pulmonary hypertension diagnosis?
Yes, for sure. That's a great question. And there are several congenital heart defects that are well known to predispose to pulmonary hypertension. And what Haley had was something called a complete AV canal defect, which is basically where the center of the heart, where all four chambers of the heart meet, just doesn't form right. And it leads to two holes in the top chambers and the bottom chambers of the heart. And what that can lead to is a lot of extra blood flow going through those holes into the lungs. And that exposes the lung arteries to both high flow and high pressure. And the longer they're exposed to that flow and pressure, the more likely they are to develop pulmonary hypertension over time.
This was a complex case because she also had a narrowing below her aortic valve. Can you talk a little bit about what that means for her pH?
Sure. So the medical term for that is subaortic stenosis, or a subaortic membrane, which is actually a very common long-term complication of repaired AV canal defects. But basically it's a little tissue that forms underneath that aortic valve, which is the main way that blood gets out of the heart and into the body. And if that tissue gets big enough, it can obstruct flow and make things difficult. And ultimately, Haley required multiple surgeries to repair that, and then ultimately to get 2 new heart valves on the left side of the heart. And it turns out that left-sided heart valve disease can also predispose to pulmonary hypertension. So Haley had multiple predisposing cardiac factors that, taken all together, it's not surprising that it led to pulmonary hypertension in the long run.
And thank goodness that you're here. And that we just want to stress, Mayo sent her here because the best care is right here in her city. Now, during our the story you saw at the beginning of the program about Haley, she talked a little bit about the darkening in her legs. Dr. Surface, why can't her heart then get the blood all the way from her legs back up to the rest of her body?
Yeah, that's a fantastic question. It goes back to what Dr. Williamson was saying. So the right side of the heart, its job is to pump blood into the lungs. And under normal circumstances, pumping blood into the lungs is a pretty easy job, to be honest. The pressures are low, and so the right side of the heart is not designed to pump against high resistance and high pressure. And when you have pulmonary hypertension that's severe, the right side of the heart really struggles to keep up with that. And the heart has 2 jobs. It's got to pump blood forward, yes, but it's also got to relax to suck blood back in. It serves sort of as a vacuum, so to speak. And all the blood in your legs is fighting against gravity, and that vacuum that the heart creates when it relaxes is part of what brings blood back. And in Haley's case, and in many patients with pulmonary hypertension's case, the ability of the right side of the heart to relax in that way and suck blood back up is impaired. And so you have blood pooling in the legs.
Is that cause a clotting risk? What would be the specific risk to that? For that?
Well, for many patients, it's symptomatic. You know, it causes symptoms, swelling in the legs, sometimes ulcers or wounds in the legs, pain. And yes, there is a clotting risk associated with that, because anytime blood pools without moving much, it's predisposed to clot. And so there certainly can be clots that we see in the legs. Yeah.
One more question for Dr. Surface, and then I promise we'll cut you loose so you can see your patients. Your first appointment with Haley is in January, is that correct?
That's correct.
Coming up about a month. But you've been studying her case so much before this. Once she's under your care, how often will Haley have to meet with you, and what specific things are you going to be looking for?
That's a great question. So we'll see Haley at a minimum once a year, and potentially more, and really anytime she needs us. And that's the most important thing, is that she's got to have a pulmonary hypertension specialist and a cardiologist available to her, you know, when she needs her, when she needs us. She still has 2 mechanical heart valves, and so we'll help manage the blood thinners that we use for that. And then, of course, she'll be at risk for other heart complications, including heart rhythm issues that we'll be able to keep a close eye on for her over the years. Thankfully, here at KU, we're fortunate to have a dedicated adult congenital heart disease center, which is exactly where Haley needs to be. And she was just talking about her prior cardiologist, Dr. Kevin Mulhern, who ran our ACHD program for many, many years before retiring. And I think it's a testament to her and his care, and Dr. Satterwhite and Dr. Williamson's care, that she's done as well as she has.
Okay, Dr. Surface, we're going to let you go, see your patients. We know you have to escape through the side door, so you are dismissed, but thank you so much for being here, and your patients are very lucky to have you. And what I really picked up from that, Haley, is that he's available whenever you want.
Sure.
Which is like a concierge doctor.
Yeah.
So that's perfect. Dr. Sood, as a pediatric critical care specialist, you're often the first one to be seeing these little ones with pulmonary hypertension, and then you send them to the specialist. What's it like taking care of those tiny patients with PH?
Patients that come to the pediatric ICU with pulmonary hypertension can have a pH crisis, and they're often very sick, and so we have to work hard as a health system in our pediatric ICU to stabilize these patients. They can have low blood pressure, they can be blue to the face, and so it's all hands on deck to relieve that right-sided pressure of the heart, to get it to relax, to make sure we can get blood flow to the lungs. And so these are very, very sick patients, because usually when they come to the ICU, they're unrepaired. And so we have to stabilize them as soon as possible.
So when a mom or a dad or grandma brings their baby to, the baby is often blue in the face?
Yeah, they usually have low blood pressure and cyanosis, and so, or hypoxia, and so they can be discolored or blue. And this is a very emergent situation when they do have a pH crisis. And so we have to really relieve that hypertension to get blood flow to the lungs.
One of the things that Dr. Williamson was talking about earlier was the cause of pulmonary hypertension. In addition to congenital heart disease, what would be another cause of pulmonary hypertension, pediatric pulmonary hypertension?
Yeah, for pediatric cases, I'd say over 60% are congenital heart disease or above, but you know, more patients are being born prematurely in the NICU, so you have bronchopulmonary dysplasia, or BPD. Some of these patients can develop PH as well. You have patients with sickle cell disease that don't have congenital heart disease that can develop PH. There's some patients that have a genetic predisposition. So most cases related to congenital heart disease, but there are a different variety of causes that can cause PH in children.
Dr. Williamson, you don't treat Haley, but one of your colleagues does. How often does Haley have to see a pulmonologist now? We know she's under Dr. Surface's care.
Yeah, of course, it's always very personalized to each individual's needs, but we often see folks every 6 months or so. I don't know if you're doing 6 months or 4 months, but...
Right now I do once a year with KU and once a year at Mayo. So it's 6 months at...
You balance it out.
Yeah.
And it's an excellent point. We often do partner with other folks, and when we do that, then we do alternate kind of back and forth. If, like I was the only one seeing her, it'd probably be every 6 months, but if she needed more, we would see her more frequently, and sometimes every year. So.
And Haley's one of many of our patients that we talk to who will tell you they went to Mayo and they were told, go back down to Kansas City and go to the health system. And so.
And we're really fortunate because we have an adult PH center, and so kind of receive patients in transition. So there's 3, now soon to be 4 docs that do PH. We have a fabulous, I'm pointing at someone who's not there, but fabulous congenital heart disease program. So for the region, we really have the tools we need to take care of folks.
It's wonderful. And we do already have some questions coming in because I can see my phone lighting up here. If you have a question, just send it to us on YouTube, Facebook, or the All Things Heart email. All those links are right there on your screen, and you can connect with us in real time right now. And Haley, while we give a moment for those questions to start coming in, one thing that I think strikes everybody is when we talked about your story and you and your husband realizing that adoption was not an option. It's more complicated than them just saying, nope, can't do it. They wanted specific letters guaranteeing things.
Yeah, so just saying that letters from my doctor saying that I didn't have any like major pre-existing conditions and that I would live a normal life expectancy. And we knew we couldn't give that in good faith. So after that, we just decided to
do surrogacy.
Yeah, try something else.
It seems unfair because you have and are living a very successful life after being told that this wouldn't happen, and here you are, you're building your nursery, you're preparing for your baby who is due in 2 months.
December 8th.
December 8th, so right around the corner. As a couple, Harrison's your rock.
Yes.
When you talk about him, you glow, and feel free to get another shot of that handsome guy who's in the control room here to support you. As a couple, how do you get through that?
Well, I mean, I was always told at a very young age that I'd never be able to have kids, so that was something I had already accepted, and I had told him that very early on. So we knew it would be difficult, and we just leaned on each other to get through it. So we did.
You guys are good partners.
Yeah.
Good partners. We have some questions coming in from our viewers, so I want to get to those right away. Becca has a great one. This is right along the lines of what a lot of people are thinking, is that does becoming a mom give you a new perspective of what it was like for your mom?
Yeah, I'm stressed all the time.
Yeah,
the baby's not even
it's
here.
only going to get worse.
My mom jokes about how like she never slept when I was a baby because she was like, I didn't think you'd like survive through the night.
Oh my gosh.
And obviously I'm not dealing with that yet, hopefully never. But yeah, I'm stressed all the time right now, and so I'm sure when the baby comes I'll be very stressed also.
It must make you want to go hug your mom.
Yes.
I know after I became a mom, I went and apologized to my mom. So I'm sorry for everything I did to you. Stu has a question. Stu would like to know if Haley has to guess, how many different meds does she take? That was a lot in that drawer.
Okay. I think I take about 27 a day. Wow. But some of those are like the same med twice a day or more than one, you know, to get the right milligrams.
Do you have a chart that helps you stay on track?
I've been doing this forever, so it's not difficult for me. I've never known anything different. So no, I just do it.
At what point when you were growing up was your mom okay with you managing your meds?
Well, pretty early on, she always joked about whenever I was like prescribed a new medication, I would like read the insert and like about like the side effects and like all this other stuff. So, I mean, I would say she did it for while I was at home most of the time, but I was still very involved in it. By like high school or junior high, I could swallow a pill when I was like 3 years old.
June has a question for Dr. Williamson. June wants to know, what do you look for in each appointment? What would a pulmonologist look for in each appointment with a case like Haley?
Yeah, it's a great question. And so first and foremost, we're looking how she's doing clinically, how are you doing with daily activities, how, what's your functional status, what can you do without getting short of breath. Then we're periodically looking at the heart itself, is it doing what it needs to do? And then, of course, looking at side effects from medicines and that type of stuff. And so we combine all those things just to see how she's doing, side effects, and then, of course, how the heart itself is doing. So that's how we approach it.
That's what you do every time.
And I think it's important to say we have so many medicines now. When I was in med school a couple years ago, there was one paragraph in my textbook that said pH typically affects young women. There is no known cure. It's fatal.
Oh my gosh.
That was the entire section.
And that's when I went to the first place. There's no medications. We can't do anything.
How horrible. But to deliver that news to you like that with your mom, I just can't get over that. That wouldn't happen here.
Well, I mean, at the time, there wasn't much. There were a few things out, but they
were.
were.
Way to say it.
Yeah.
Okay, Dr. Williamson.
Now that we have a lot, just to say we have maybe 10, 15 medicines now.
There's options. Options, and clearly you have a lot of life. Your nursing school is so stressful, and you went through all of that with flying colors. Oh, by the way, she's wearing scrubs right now because she is a nurse here within the health system as well. Where do you work within the health system?
I work at the specialty surgery clinic or surgery center on 74th and State Line, where we do eye surgeries.
I'll have to have my mom look for you when she's in there. Marie has a question for Dr. Sood. What are the most common symptoms of pediatric pH in children? Would you notice it immediately? You mentioned the face going blue. Are there other symptoms?
Yeah, so with a pH crisis in the hospital, those are more acute, immediate symptoms. But if you're out of the hospital and you're worried about pulmonary hypertension, which is very rare in children, you could have a child coughing up blood. You could have fainting or syncope. You could have fatigue or lethargy and shortness of breath. And you could have chest pain. But if a patient or a parent is telling me their child's coughing up blood or having chest pain, it makes me want to potentially work up a pH.
That's where your mind goes.
Yeah, it does.
Ashley wants to know, this is a great question, what's more common, pulmonary hypertension in your pediatric patients or in adult patients?
More in adults than kids, usually women aged 30 to 60, the most prevalent group. Out of 1 million children, only about 30 of them have PH if you take 1 million children. So it's a very rare diagnosis, but there's multiple ways a child could get PH.
Okay. And then how long can you live with untreated pulmonary hypertension? Dr. Williamson.
It really depends on what causes it and how severe you are. And so for folks who have certain types of pH that are very advanced, sometimes the lifespan is a couple years or less without treatment. The good news is for adults, the majority of patients have a chronic manageable disease with treatment and improvement in the quality of life. And I've had patients I've followed for 20 years here. And so the bottom line is we don't leave pH untreated unless they're just unusual circumstances.
Right.
So with treatment, folks can live a really long time. Without it, it's a lot more limited.
You need the treatment that we can provide. Real quick, Dr. Sood, you refer the pediatric pH cases to a pulmonologist. Do you also refer them to a cardiologist?
Yeah, so different causes of pH. So for congenital heart disease, definitely following up with a pediatric cardiologist. But if you have a premature baby who is in the NICU with bronchopulmonary dysplasia that develops pulmonary hypertension, needs to see a pediatric pulmonologist as well. It's a multidisciplinary approach, cardiology, pulmonology. In some cases, you need a rheumatologist as well. And so it depends really what is the etiology of the pulmonary hypertension, and then how to get the best multidisciplinary team around the patient to optimize their care moving forward.
It takes a village.
It does.
Dr. Williamson, you were nodding your head. Did you want to add something there?
No, I think it does take a village. It takes a multidisciplinary team that's familiar with pulmonary hypertension and the other things associated with it. And so I don't treat pediatric pulmonary hypertension, but we transition patients from pediatric programs to us, and it's a village. We all have to work together.
As we wrap up this discussion, and gosh, I'd love to talk to you all day about your journey, Haley. I'd love some final thoughts from all of our guests, and I do want to start with Haley. What would be your message to other people watching who may be facing a different kind of daunting health challenge and health battle and feeling despair?
I think just acknowledging that it can be really difficult sometimes, but it's good to find doctors you can trust and have a good support system, and don't be afraid to ask for a second opinion if you don't feel comfortable with the answers you were given.
We know you talk about support system, and your hubby,
Yes.
Harrison, is in the control room. Anything you wanna say to him? There he is.
I mean, he's a great guy. I don't know. I love him a lot. He's supported me through everything. He's been there for all my surgeries, all my hospitalizations, and I'm very lucky to have him.
And he adores you. He's a lucky guy. Dr. Sood, you don't always get to see your pediatric patients later in life. What does it feel like seeing someone who, you didn't treat Haley, but you're seeing a former pediatric patient thriving?
It's incredible, and my big message is resiliency. If I could describe one adjective of Haley, it'd be just how resilient you are. And so to see how resilient a patient can be, go through so many surgeries, go through so many medications, yet live such a fulfilling and thriving life, just fulfills my heart to see. And so it's fantastic. It's been a great morning.
Thank you.
Next to you.
Dr. Williamson, what would you like to add?
I think it's that message of hope, and that we have so many more therapies with so many more coming down the road and innovations in surgery. So I just say hope there. And what Haley did, not taking the first opinion if someone says there's nothing to offer. There's
Right.
usually something to offer. So, but it's a message of hope.
Your mom said not good enough.
Yeah.
And you're going to be an amazing mom.
Thank
because
you.
you're going to pass that on to your daughter as well, that resilience.
Yeah.
And that's such a crucial thing you need to get through life. We love sharing the incredible work that our doctors do here at the health system. Have you ever wondered what your doctor is like outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Sood, we know you love the Jayhawks, Syracuse, you love your family. Who's in these pictures?
Yeah, that is, during Thanksgiving time, we like flannel. And so that was the first picture. It was with our Jayhawks. We're all wearing flannel. That's Dr. Lewis and one of the pharmacists. The second picture was with the entire pediatric ICU team, Travis, Francesca, Amer. And then that was my mentor in college, Dr. Kopinski. He's from Syracuse, and he came to visit. I took him around the pediatric ICU, and such a strong influence in my life. And so when he came to visit, and his wife, it was just so great to see. So I included that today.
I love that you submitted pictures of your mentor. It's wonderful to see. Okay, Dr. Williamson, we know you have two kids, grown kids, sort of grown, that you're very proud of. I want to show a video to our viewers that you sent me of your daughter.
Yeah.
What on earth?
I know, right? So
Right.
we'll show my son next time.
Yes.
But she is in circus school in London.
Cirque du Soleil?
We'll eventually go for that. So
Okay.
it's a 3-year school. She took a break last year and went to Mongolia to learn mouthpiece. So basically balancing on her mouth.
How do you even think to try this?
I don't know. I really don't. But she does a lot of other cool stuff with trapeze and contortion. And after this, she went to northern Mongolia to stay in a reindeer farm for a few days, as one does. So I literally never know what city she's in, let alone what continent. So, but she's pretty amazing, and so is my son, and we'll show him.
Yeah, he's a performer as well. Now, she's holding onto a mouth grip and throwing her legs over. That's not considered contortion. You said, she does this and contortion.
It's a form of contortion.
Bending over for the remote is a form of contortion for a lot of people.
Off the floor, but yeah, it's a very specialized form that not many people do, and she wanted to go learn it.
Well, you're next. Ready? Show us what you can do.
If I can get out of my chair, that'll be just good.
Thank you so much for making time to be with us today, Dr. Williamson, Dr. Sood. Haley, thank you for sharing your journey. It's so inspiring. If you would like to watch or share any one of our episodes, just type the URL in. It's case sensitive, or you can scan the QR code. You'll see it right there on your screen. It will take you to a list of all of our programs. Really interesting viewing and fantastic patient stories as well.